differentiate empyema and emphysema. So first empyema is a collection of pus within a body cavity. And emphysema is an abnormal or permanent enlargement of actinous. So actinous is a cluster of cells that resembles many bold, like you can see the picture. So it's full of cluster of cells, and when we are looking, it's look like a berry. So that is the emphysema is the abnormal or permanent enlargement of acne associated with the alveolar wall destruction with no significant fibrosis. And the empyema is usually a complication of infection, and the emphysema is occur as a result of persistent any chronic inflammation. And the empyema, the patient will be having a fever, high grade fever, and emphysema, there will not be associated with fever, but it may occur due to a superimposed infection. So the superimposed infection, overall the top of the person is exposed towards infection for a long time. That is the main cause for emphysema. So empyema can develop after any pneumonia. So the patient, those who are having a pneumonia for a long time, it may be causing empyema, and the main cause for emphysema is long-term exposure to airborne irritants, such as the person is a first-hand or second-hand smoker, that is tobacco smoke, or exposed towards an air pollution or chemical fumes or any dust. And the symptoms mainly in empyema, the people will be having a shortness of breath, dry cough, fever, and high-grade fever, sweating, chest pain when the patient is breathing, and it will be a stabbing in nature, and a headache. And the main symptom of emphysema is shortness of breath, and always initially that emphysema patient will be asymptomatic, and the shortness of breath will be occurring gradually. And the diagnostic evaluations in empyema, chest X-ray and CT scan will show where exactly the fluid in the pleural space, and ultrasound of the chest also will show that amount of fluid in the exact location. And in emphysema, that chest X-ray will not be useful to detect that early stages of emphysema, and because most of the patients will be asymptomatic at the early stage, and better we can go for a spirometry or pulmonary function test. This is the most useful test to determine airway blockage, and even we can do the arterial blood gas analysis. So here we can measure the amount of oxygen and carbon dioxide. And the treatment in empyema, treatment is aimed at removing. So here mainly there is some pus collection in the pleural space. So for emphysema, our main goal is to remove the pus and fluid from the pleural space and treat the infection. So we will start with an antibiotic therapy to treat the underlying infection, and the treatment of choice will depend upon which type of bacteria that the patient has been exposed towards. And in emphysema, mainly we will give bronchodilators in order to dilate the bronchial muscles, and that is deriflin we will give, and handheld inhalants we can give, and oxygen therapy to maintain the normal saturation level. And coming to the surgical management in empyema, thoracostomy. So this is a procedure. Here the doctor will be inserting a plastic tube into the chest after giving a local anesthesia between the two ribs. So between the two ribs, a plastic tube will be inserted in order to drain the pus and fluid in the pleural space. And in emphysema, the surgery, that is lung volume reduction surgery. So here what they will be doing means the portion of affected lung will be removed, then joined together, remaining tissue will be joined together. Coming to the nursing management. So nursing management in empyema. So here we have to maintain the oxygen above 93%, And in case the patient is having a pain after removing the pleural fluid or the pus, we can give analgesic. And to treat the fever, we can give antipyretic paracetamol. And even we can, because since we have drained the fluid, the patient may go for a fluid imbalance. So better we can balance the fluid and nutrition. So fluid and nutrition management will be given, and to strictly we should maintain the intake and output chart. And in emphysema, so main priority is maintain an airway. So humidified oxygen should be given 24 hours low, that is minimum 4 liter of oxygen. Via nasal prongs we can give. The dehumidified oxygen should be given to maintain the oxygen saturation level. And in empyema, mobilization. So we can mobilize the patient to improve the respiration and improve the pleural circulation. And in the emphysema patient, so we should encourage the patient to use controlled coughing, and coughing and breathing exercise we can teach, and postural drainage we can do, so that all the secretions will be getting soothed, and so that the patient will be getting some clear in the lungs, so they will get enough sleep. Thank you.